Hello, everyone, and welcome to our special Mother's Day edition of the Flint Community Webinar, your community resource every Friday at noon. In light of Mother's Day, we've got a lot of really great people here today to talk about maternal health, preventative health. We've got Dr. Omar Young here today, who's going to talk to us a little bit about preventative health and mothers. We've got Dr. Janae McCoy White, who's going to talk to us a little bit about maternal mortality. We've got one of my students here who's going to talk about a health fair that we've got coming up at the Latinx Community Center. We've got Dr. Aisha Harris, who's going to help us think about women's health and preventative health. And we've got Bobby Coates here from the Legal Center of Eastern Michigan. So lots of great, helpful advice for people today. And we'll get started. I'm going to start with Sebastian. Sebastian, how are you?
I'm good. How are you doing?
Good. It's so good to see you. So I understand that you, with some of the other med students who are from MSU College of Human Medicine, the Flint campus, are leading a health fair. Can you tell us a little bit about it?
Definitely. So we've partnered with the Latinx Technology and Community Center here in Flint, and we are helping to host the second annual health fair that they've put on. And so in addition to great food, some like prizes and other like games, including like things like rock wall and bounce houses for the kids and things like that, we're hoping to put on a huge health initiative here. And so we're going to be screening for diabetes, hypertension, skin cancer, and we're also going to be providing resources for vaccinations, STI testing, HIV testing, and getting folks set up with their like a primary care doctor if they don't have one, and really trying to promote the health and wellness of communities that often are underserved here in Michigan. And we're really excited for it. It's going to be happening not this Saturday, but next Saturday from 12 to 3.
That's amazing. So you're a third-year med student. Are you just doing this with all of your free time?
Yeah, all the free time that I have. No, it's so it's part of my program, being part of the leadership in medicine for the underserved. So similar how other schools have a public health branch of their medical school, I'm a part of this special program, and we've been dedicating time since the fall to help put this help put this health fair together. So it's really amazing to be able to be a part of something so big and hopefully have a big impact in the community.
That's super cool. So as a part of like all of your other work in third year, which I happen to know because one of my other hats is getting to hang out with you all, in addition to all the work you do, like rotating and learning medicine on what we call clerkships and being in the hospital, you're in the special, and we call them certificate programs, where at the end of doing a certain amount of like work in the community, you have the opportunity to like get the certificate that says you did a certain amount of work. So you engage with a community partner. In this case, it sounds like you partnered with the Latinx Community Center.
Yep. Mm-hmm.
That's amazing. Can you tell us a little bit about any other student involvement? Like, is it just you, or are there other students who are working on this?
Yeah, and so it's me and then two of my other classmates, Melanie and Enrique. And there have been other students in the past who have helped put on this event last year for the first time. And so we're really, it feels like we're standing on like the shoulders of giants, you know, and being able to kind of like make this even better. And hopefully we can continue making this better with every year. But for now, it's just me and two other students. And then, of course, in addition to the staff at the Latinx Technology and Community Center, who have been fantastic in helping us out create this amazing event.
And it sounds like you've got some volunteers that are helping, right? You've got some residents from McLaren Family Medicine who are helping out. Dr. Polkroll is helping out. You want to shout out any other people who are helping?
Yeah, we have Dr. Khan coming out as well. We also are having Dr. El Sayed coming out. A lot of our Spartan Street medicine folks. So that's a program here that we have at the College of Human Medicine. And any other students that are like interested or coming, we're having about like 20 volunteers. So really big turnout, and we're really excited to see everyone contribute.
That's fantastic. Thank you so much, Sebastian. I know I took away 5 minutes from like what is not a long lunch break that you get. So super appreciate you. Do you have any shouts out for Mother's Day that you want to say? Anything you want to say for Mother's Day?
Oh, I mean, big shout out to my mom. I love her dearly. Wouldn't be here without her. And shout out to all the moms out there, who love their children and just make this world a better place.
Thanks, Sebastian. All
Thank you.
right. I'm gonna ask Dr. Young to like take us off into with that really beautiful tribute from Sebastian. And shout out to Sebastian's mom. I'm gonna ask Omari, Dr. Young, to talk to us a little bit about maternal health and the things we should be thoughtful about there.
Awesome. Thank you again for having me.
Absolutely.
I can start off with my Mother's Day shout out to my mom, who's a registered nurse. So she also keeps reminding me to provide comprehensive care, not just from a physician standpoint, but also gives me the nursing perspective in providing maternal care. My stepmother, who's a social worker, so again, gives me added perspective, and just all the strong women in my family. And then also most importantly, as being an OB/GYN, I work with amazing, strong mothers every day throughout my job. So happy Mother's Day to all the moms out there working hard. So the topic that I'm speaking on is postpartum care, and the kind of term we also give it is the fourth trimester. And I think the biggest takeaway I want the audience to take away from this is there's been a big paradigm shift in how we view postpartum care. I think as most recently, when I was a medical student, even as a resident physician, postpartum care was kind of an afterthought. There really wasn't much attention put to it. I mean, when we were around after a mom delivered, we peek our head in, you're doing okay, eating, drinking. And then we say, we'll discharge you and see you in 6 weeks. And now, again, that was the traditional thought of postpartum care. You discharge them home, and then you'll see them for their 6-week postpartum visit. If they had a cesarean delivery, you'll see them within a week or two to make sure that from a surgical standpoint, the incision's doing well, and then you will see them again for that 6-week postpartum visit. But we really found out that that postpartum transition period from being pregnant, going through the delivery, and going to your non-pregnancy state is prime for high morbidity. And there's a large amount of maternal morbidity and mortality that occurs in a postpartum period that we previously didn't pay attention to. So now the recommendation is from that 6-week postpartum visit. Actually, we want you to see your primary maternal health provider, whether it's OB/GYN, family physician, or midwife, within 3 weeks, and maybe even sooner if there are any comorbidities such as diabetes, high blood pressure, mood disorders, and then also for a second visit or even more visits within an overall 12-week period. So going from that 6-week postpartum period to now, we consider that postpartum period to up to 12 weeks now, because again, that morbidity related to pregnancy extends farther out than that traditional 6-week view. And then when we talk about that visit, it's a more comprehensive visit. I think generally we kind of left the work, and again, I think culturally we left that work to the family as far as managing postpartum period. And really, as healthcare providers, we need to acknowledge the physical toll and the mental toll and the emotional toll of pregnancy, delivery, and the postpartum period of mothers, and really make sure that we put those systems in place. So just from a physical standpoint, was it a traumatic delivery, whether it was vaginal or cesarean delivery? Was there an emotional toll related to the delivery? Do you have pre-existing mood disorders or mental health disorders? Do you have comorbidities, high blood pressure, diabetes, thyroid disorder, any other kind of comorbidities? And just overall making expectations about what do you want to do for your next pregnancy, talking about contraception, talking about sexual health, and putting things in orders, whether it be case management, social work, home nursing visits. So really having that comprehensive view of postpartum care has really changed. And again, it also to it as an opportunity to transition our mothers into lifelong healthier lifestyles. So as we were alluding to earlier, linking up with primary care providers. So using that postpartum period to optimize their overall well-being and overall health. So getting them connected with a PCP, whether it be an internal medicine physician, family medicine physician, getting them linked in with counseling with a psychologist or a psychiatrist. So really taking advantage and then also providing them adequate contraception so they can appropriately space out pregnancies, or generally just to review what happened during their pregnancy and review what happened during the delivery process. So many times we get referrals from outside hospitals for a new pregnancy, and there's a large discrepancy between what the patient's awareness of what happened during the delivery and what's written in the medical record. We'll say, oh, how was your delivery? Oh, no issues, it was fine. Come to find out they were induced at 36 weeks, they had a postpartum hemorrhage, they had preeclampsia, but the patient wasn't aware of all those things that happened during the delivery process. So again, I think using that time period also to revisit what happened during your pregnancy, what happened during the delivery process, and not just from a clinical perspective, but also just if it was a traumatic experience, and it allows mothers to just acknowledge what happened to them. And also it can be lessons learned for us as providers on how we can do things differently, not only for her, but also as other patients who have similar experiences. So big picture, the paradigm shift is we're being more engaged and being more attentive during the postpartum period, or what we call the fourth trimester, because again, there's a high amount of morbidity and mortality related to the postpartum period, whether it be DVT, PE, blood pressure, ongoing bleeding. So again, and it's not just the traditional OBGYN that's involved with this care team. It's the patient, it's their family, their other support systems, social work, getting them linked in with a primary care provider. Another thing that we really have capitalized on is physical therapy. The pregnancy process and the delivery process is physically traumatic. So we have pelvic floor physical therapists who work with the mothers after delivery, whether it was considered traumatic or not. So there are so many pieces in place now to provide comprehensive postpartum care.
Dr. Young, can you tell us, like, why is it that the postpartum, that 6 weeks or so, is so risky, right? Like we talked a little bit about, sometimes it's just, it takes a lot of toll on your body, there's less focus on the mother, but what happens postpartum that just makes it so much more risky for the mother?
I think one is it's a vulnerable time period. And I think
Sure.
it goes again to that context that historically and traditionally we put so much emphasis on the pregnancy, and then, once the pregnancy is over, then we assume, whether it's right or wrong, that you have all the tools and pieces in place to support yourself after
Right.
delivery. So I think, again, that's a very prime opportunity to miss things in the postpartum period.
Absolutely. And you mentioned things like hypertension and DVT. And I'd wonder if you talk for just a couple of minutes about what that means for people, and Dr. MiCHWA-White's going to get into maternal mortality, but when we hear about these really prominent stories in the news, we're hearing about people like Serena Williams having
Yep.
exactly. Myself, I had postpartum preeclampsia, right? So those are things we might have context for. And I wonder if you just talk a little bit about what that means for people.
So pregnancy in general puts you at high risk for blood clotting. So whether it be a blood clot in your legs or blood clot in your chest, which is a pulmonary embolism. So that was well documented, well aware. So we knew about that. But then that risk is even higher in the postpartum period, because one, especially if you've had a cesarean delivery, you're not as active, you're sitting down, you have sedentary lifestyle. If you had surgery, and then also, again, if you have those comorbidities, if you're obese, if you had a pregnancy complicated by preeclampsia, and then also if you're inadvertently prescribed certain types of birth control, you're just putting all these different pieces that it could put you at risk for a blood clot after delivery.
Absolutely. This has been super helpful. Super appreciate. I mean, we talk a lot about like what to do when you're trying to get pregnant or what to do while you're pregnant. We don't spend a lot of time talking about the postpartum period and how we keep mothers safe. Super appreciate all of your excellent advice and all of your excellent expertise. It's been really, really helpful. I want to bring Dr. MiCHWA-White up and think about any of how her research and how the work she's been doing dovetails with the conversation that Dr. Young has just started.
Yes. So so part of our research is maternal morbidity and mortality disparities. And so we have a maternal mortality disparities workshop that we do to, number one, is an actionable maternal health focused anti-racism training that we hold every 6 weeks for those who work with pregnant people or postpartum people. And that's for those in healthcare or human services settings, which includes doctors, midwives, doulas, nurses, community healthcare workers, social workers, their front desk, their back office, as well as hospital CEOs. This is focused really on maternal health equity specifically. We have extensive discussion on the current literature and actions that can be taken to improve maternal health equity. It's grounded in reviews for African and African American history and how these things to inform people about to reduce maternal morbidity and mortality disparities. But our goal is to have everyone who interacts with pregnant people providing care or resources in Genesee County to attend these. These are free for anyone. These are virtual for anyone, but then there's also lower requirements. It fulfills those requirements for anti-bias training, but it does so much more. So it talks about the importance of postpartum visits and how we need to help each other when that individual have had a baby, and what we need to do after having a baby, as well as what we need to do while they're pregnant. And so this is like really great. It's free. And what we tell people, you can actually do this at home. You know, you don't have to come in, you don't have to, you know, sit somewhere, but it's interactive. It's developed by community members who actually have, number one, lived experience, but they're also have their work experience in these areas. And so our dates, we have our next one is May 19th, next Friday. And we have them throughout the year, June, July, August, September, October, and November is the ones that we'll have for the remainder of the year. And thank you. They put it up on the screen that you can see the actual flyer and how you can register for that. This is an amazing thing that we are trying to do to just reduce maternal morbidity and mortality disparities, but also just reducing those stigmas that some of us as African American women have to go through when we're delivering children. And I would love to shout out for Mother's Day, my mom, who is an amazing woman who has taught me so much about just working to help and uplift others. So happy Mother's Day. And to all the awesome mothers that I work with daily, happy Mother's Day. And I hope you get what you want. If it's rest, get you some rest.
I love that. Thank you so much, Dr. McCoy-White. We really appreciate all of your help and support. Sorry, I'm having technical difficulties over here. I'd like to bring in Dr. Harris to talk a little bit and dovetail a little bit with your conversation on disparities. Dr. Harris, I know you're going to talk to us a little bit about more generally, not really maternal mortality, but talking to us more generally about how we care for our bodies and the preventative health side of things. So Dr. Harris, you have the floor. Thank you.
Yes, thank you. I appreciate being able to speak about this. So as a family doctor, I have a past training of caring for women who are pregnant and deliveries, but I do less of that now. And I am more classically part of the pre and the post kind of phase. And so I won't go into postpartum since Dr. Young went into it with a lot of great thorough detail. But I do want to speak on the pre-pregnancy phase, things that happen during pregnancy, and what I look for as a family doctor after someone has finished their pregnancy and in their postpartum phase. Because when you are trying to get pregnant, obviously that's a personal activity, but if you are trying to get pregnant and you have certain medical conditions or you have certain medications, it is beneficial for you to inform your primary care doctor that you are trying to get pregnant, so that way they can see about your history, see about your medications, and see if anything should be changed in order to make your pregnancy the safest and kind of prepare your body as much as possible. I've seen a lot of people who have kind of gone through the process of fertility and trying to get pregnant and did it alone when they could have gotten a lot of medical support from either their OBGYN, their family doctor, any kind of community resources in their area. And so it is something that you don't have to completely do alone as far as what your health status and health foundation is. And so I definitely encourage everyone to let their doctor know that they are trying, that they feel like this is something that they want to do in their next chapter. And so you can discuss all your medical risk factors, your medical like status in general, because there are medications and certain medical problems that may worsen during pregnancy. There's also certain medications that people take on a day-to-day basis that can be well, they can, I won't say damaging, but they can be harmful to the fetus or the baby during the growth process. So we really want to optimize that experience for everyone. And by informing your doctor that you are trying to get pregnant, you can get the most benefit of your pre-pregnancy kind of chapter. During pregnancy, we know there's a lot of appointments. They kind of build up as you go through pregnancy and get farther along. But one of the beauties of pregnancy, as it being a special chapter of growing the little human and eventually kind of having the birthday at the end, there are a lot of testing that happens. Some of it is your standard women's health testing regarding, you might get caught up on your pap smear during some of your prenatal care in general, because you just have so many appointments. It's a very opportune time, but you also may get screenings for anemia and diabetes, and you get your blood pressure checked on a regular basis. Some people might get their thyroid checked. And so I say this in the sense that some of these are just part of the recommendations during pregnancy kind of guidance as far as checking in on things, because your body changes so much. But some of these should be followed up on afterwards. So you don't do a pap smear very, very deep into your pregnancy. It's more in the beginning. But sometimes those can become abnormal and you might not do any treatments or follow up during your pregnancy, but that's something your family doctor or your primary care doctor should know about. So that way they can follow up based on the recommendations and based on what those tissue samples say. If you have abnormal labs regarding any blood work as far as your diabetes or your anemia, those things may cause you to have special treatment during your pregnancy. But after your pregnancy, anemia, high blood sugar as far as diabetes, high blood pressure as far as hypertension or preeclampsia, if you had that kind of during or at the end of your pregnancy, all those things immediately are evaluated kind of while you're doing your pregnancy, but post your pregnancy and the postpartum, but also just in your adulthood in general, pregnancy abnormalities or pregnancy problems can increase your risk of having those chronically. And so as much as we hope that people don't have additional medical problems after pregnancy, because it changes so much of your body, your physical and your mental health can be adjusted or transition into a different chapter based on your pregnancy experience. And so those are things that, like Dr. Young has said, like you should know as much as you can about your pregnancy and your delivery. So that way your postpartum phase and your just general adult kind of screenings and women's healthcare can all be on the same page. And so not necessarily that you're repeating things, but you're following up on things that happened during pregnancy and you might not have been focused on them because obviously you're focused on your health and the baby's health, but there are things that your primary care doctor should know about so that way they can check up on it. I will emphasize the mental health aspect. So we talk about the baby blues, which is kind of a temporary mood shift, as well as postpartum depression. But there also is other things that we get concerned about as far as postpartum psychosis, which is a little bit more of a serious mental health disorder that can cause people to make decisions that are completely out of their norm. And so we really want people to, during their checkup appointments, during whatever, even if it's your child's checkup appointments, to really speak on what's going on, because even pediatricians or family doctors taking care of your child can put you with the right resources so that way you're able to completely maximize your health resources and what's kind of going on with your mind and body. Sometimes when people come into pregnancy with a mental health disorder, whether it's bipolar disorder, schizophrenia, depression, anxiety, whatever it may be, sometimes things are okay and they continue the medicines during their pregnancy, but sometimes they also have to take a shift in medicines, or after their pregnancy, there's a change in their mood that we have to kind of reset and adjust kind of different medications so they're back to who they are before and feel the kind of best version of themselves. Those are the main things that I really want to kind of speak on as a primary care doctor. I help people prep for getting pregnant and have some success with them getting pregnant, but also understand that it is a challenge to sometimes get pregnant. And so whether you are having your fifth child or your first child, please inform your doctor that you are trying to get pregnant, so we can help you evaluate your status, help you evaluate resources, and make it the best experience as possible, but also get you connected with the right people just in case it's not going as planned. But after you are pregnant and you're getting through the postpartum phase and then just going back into your regular adult health, we really do want to follow up on things that happen in that special pregnancy chapter, whether it's abnormal pap smears or abnormal blood work or changes in your like mood and mental health. We really want to kind of get things rechecked and reevaluated so that way you're the best mother you can be and also just the best version of yourself personally. Those are the main things that I wanted to say. Just so I wouldn't.
Dr. Harris, I want to ask you a couple questions because you mentioned such good information and I wanted to like disentangle some of it if we could. So I want to know, like, someone comes to your practice, and we can get Dr. Young up here too if he wants to answer. And so we're all in primary care. We all take care of potentially pregnant patients. And I wonder, someone comes into your practice and they're like, I'm thinking about starting this new chapter. I'm thinking about trying to get pregnant. What's the first like 3 things you want people to know, or what are the things you're telling patients who come to your office and are like, I think I'm ready to start trying to get pregnant?
The first thing that I'm telling people if you're planning to get pregnant is to start taking prenatal vitamins, just so your health is as maximized as possible. Second, as their primary care doctor, I'm looking at their medications and their medical health history to see if there's anything that we should be watching out for, if anything that we should stop. I will say that sometimes people are on medicines before pregnancy. We change it up while they're trying to get pregnant or are pregnant, and then we should be changing them back to the more ideal medicines. And I've seen people on a lot of like during pregnancy medicines that are kind of working, but not really working, specifically labetalol, which is really annoying because it's like multiple times a day. And I'm always surprised that people are really taking it after pregnancy. But there are changes that should happen afterwards that we should kind of start that process before. And the third thing is when people are trying, they should be trying frequently and they have to try for a while before we actually kind of evaluate if there's some infertility concerns. I think a lot of people think that it happens very magically, which pregnancy is a beautiful thing, but there is a small window. And so you really have to understand your fertility awareness. And so that's something else that I kind of talk to people about, but also understand that it's not going to happen always in like a month or two. Sometimes it takes multiple months before I send you to someone like Dr. Young to kind of optimize your fertility process. But I would say those are probably the main things that I talk about and hope that they are successful and they come back pregnant and we can start their transition to a great OB doctor.
Yeah, I would say similar sentiments.
I love that you said that because I think.
Oh, no, we lost her.
We lost her.
We did lose her, but if you don't mind, just keep what you
Yeah,
started.
I can follow up. Yep, I can follow up on that. So I would say similar sentiments is that the best outcomes are with a planned pregnancy. So our term that we use is preconception counseling. So, and again, it's an appraisal of your health status. So do you have any pre-existing medical conditions? What's your previous obstetric history? And again, that goes back to, do you know what really happened during your previous pregnancy? What complications you had? When was the interval between those pregnancies? Because we know that short interval pregnancies put you at a higher risk for your current pregnancy. So simply put is, when you're deciding to get pregnant, see somebody. whether it be a primary care physician, whether it be a midwife, whether it be an OBGYN, so they can take that appraisal of your health status. Again, start you on prenatal vitamins, start you on any other medications that are revealing, because again, we always think of pregnancy as a physiologic stress test. So if you're teetering with your blood pressure, teetering with your blood sugars, or any other kind of medical disorder, pregnancy is going to reveal that. And again, that can extend into lifelong chronic illnesses.
I think both of you mentioned prenatal vitamins at some point, and I think I'm glad that you mentioned, like, make sure you get your prenatal vitamins, and make sure at least you're getting your folic acid in, right? That's really, really important. I appreciate so much Dr. Harris setting the context for, like, it's kind of magical, right? I still remember learning about it in med school and thinking, like, all of these stars have to align, and it happens so often, but it's still like, it's not like it's going to happen necessarily in a month or two. Dr. Harris, you mentioned this. Dr. Young, I wonder if you have any comments on that, like that, the idea that it can take a little bit, and we need to be thoughtful about that.
Yeah, we'll commonly, and I think part of our job in that aspect is just to provide reassurance. Like, you don't necessarily need to jump to $1 million infertility workup. So part of that counseling is just to calm their nerves down, that anxiety around getting pregnant. Because again, pregnancy is one of the biggest financial decisions that a woman and a family is going to make. So they're trying to plan it around big things that are going on in their lives. So I totally understand that. But again, we want to provide reassurance of what does it mean? What is the true definition of infertility? And then what is the true process of having regular unprotected intercourse? Do you have normal menstrual cycles, things like that, to really thoroughly evaluate your fertility stats before going down that road of $1 million infertility workup?
These are great questions that people should have as they're thinking, like, okay, I'm thinking of getting pregnant. I need to see my primary care doctor. These are the things I should be thinking about. These are the things I should be asking. Dr. Harris, you mentioned a little bit about, like, anemia and high blood pressure and really wanting to screen for those. Dr. Young mentioned, right, like, that pregnancy is basically a stress test. So it would make sense that we would want blood pressure control. I wonder if you'd talk a little bit about, like, why anemia is such a common thing in people who might be trying to get pregnant.
Yeah, I can speak on that a little bit. So we know there's a lot of different types of anemia, but the most common, especially in our community, is iron deficiency anemia. And so people can have that and it not be a problem, and it just kind of fluctuates. They have their energy level fine and they're oxygenating their body okay. But some people have really low iron, and that impacts their blood count. And when you impact your blood count, that is impacting the oxygen that's getting delivered to these different organ systems. And so during pregnancy, just like Dr. Young said, it's a physiological test, stress test. And so everything is changed and adjusted. And one of those things that happens is people have an even lower iron level during their pregnancy. And so that causes them to possibly be more anemic than they are when they aren't pregnant. Sometimes people have the reserve to compensate for that. But if you're already going into pregnancy with anemia or already have a low anemic level in general, whether you feel the symptoms or not, pregnancy can exacerbate that or cause that to flare up. And we already know that pregnancy is a tiring process and experience. And so to not have the energy level or the oxygen or blood count level that you need to do your growing of your baby or your day-to-day task, that could be really impactful. And so a lot of women do end up taking iron during their pregnancy. After pregnancy, they may not need it at all, just because the pregnancy is what kind of made them need the iron. But that is a common thing that happens, that we do want people to be aware of, just in case during their delivery, they lose a lot of blood and their reserve is even lower. But even after delivery, if there's something that just doesn't bounce back like we expect.
Thank you. Any last comments that you want people who are trying to get pregnant, new moms, people who want to become moms to think about in terms of preventative health?
I think I said most of the things, but I definitely emphasize taking prenatal. I mean, you can take prenatal vitamins whether you're trying to get pregnant or not. They're great. But I really think encouraging people to talk to their doctor if they're thinking about it, but also speak to other women that they know who are trying to get pregnant or have gotten pregnant, because it is a specific experience. The first and last pregnancy are always different, no matter if you've gone through it multiple times. And so I really encourage people to talk to each other, whether it's about breastfeeding, whether it's about the first trimester, or you might be spotting that you need to get checked up on. If we have a strong community of women kind of supporting each other during the process of trying to get pregnant and while they're pregnant, then we can have a lot more healthier pregnancies based on people's experiences and stories. Yeah, that's probably my main thing. And I guess regarding Mother's Day, my mother was an awesome woman, and I am the person that I am because of her. And I also have a lot of amazing aunts that have set great examples for me to continue to be an amazing aunt. So I wish everyone a happy Mother's Day, and I hope you get everything that you want or get all the rest and attention that you deserve.
Special shout out to Dr. Harris, because I have seen her be auntie and it's adorable. Like her little nieces and I think you have a niece and nephew, right?
I have a niece and 2 nephews. I got a fresh one. He's 4 months old.
I've seen the pictures and they adore you and you're great. So thank you. Dr. Youngo, we still have you. I wonder if there's any comments, because Dr. Harris mentioned something about pap smear screening. And I wondered if you talk a little bit, just a couple minutes, about cervical cancer prevention and what that pap smear is for.
That's a great point. So pregnancy can be protective in some areas, but again, medical conditions still can occur during pregnancy, and including cervical dysplasia or cervical cancer. So that shouldn't be disrupted during pregnancy. So you should still follow the routine guidelines of cervical cancer screening with pap smear. So if you're at least 21 years of age and you're due for a pap smear, despite you being pregnant, you can safely get a pap smear cervical cancer screening during the pregnancy. And again, if there's anything abnormal, that can either be deferred after pregnancy, or we can do further workup during the pregnancy, depending on the pap smear findings. So pregnancy does not exclude you from the recommendations as far as cervical cancer screening.
Thank you. Thank you both so much for your wonderful expertise. We really appreciate you. All right. I think next up, we're going to go to Bobby Coates. Thank you so much, Bobby, for being here to talk to us a little about legal services. We're super happy to have you.
Hi, thanks for having me. I'm happy to be here. It's a little chaotic today, but we're gonna make it through and talk about some legal wellness. Do you have any questions before I get started, or would you like me to just jump right in?
Well, you can jump right in, or you start with your Mother's Day shout out, or you can end with your Mother's Day shout out, whatever works for you.
Okay. All right. So when you think about medical outcomes and wellness, you don't usually think of attorneys. Ordinarily when you think of medical and attorneys, it's sort of adversarial. But legal wellness is a concept that I came up with to sort of explain the work that we do with our clients, because it often goes beyond the courtroom. And as a matter of fact, a lot of what we do never even goes into the courtroom. Can we go to the next slide, please? Okay. So Legal Services of Eastern Michigan, I'm going to start out with a little introduction of who we are. We are a civil legal aid organization, and we serve 14 counties in Eastern Mid-Michigan. There's a list there on the screen. I won't go over them all. And so we serve these counties. I actually think we should have go back a slide. I skipped that first one. I'm sorry. Okay. We're a nonprofit civil legal aid organization. We fall under the umbrella of Legal Services Corporation, which is a national legal aid corporation that gets funding from the United States government to assist low-income individuals with accessing areas of the law that they frequently don't know that they have a right to have an attorney to represent them for, or that they can get legal assistance with. Just recently in 2001, the University of Denver published a study, and I included a quote there with a source link, discussing the problem of access to justice. 66% of the population experienced at least one legal issue within the past 4 years of the study, with just less than half of those problems having been resolved. There's a huge gap between the people who can afford legal services and the people who aren't able to get these services, and they think that they have to navigate these issues alone. All right, now we can go back to the next slide. Okay, and so as I mentioned, we serve 14 counties in eastern mid-Michigan. We also have sister organizations all around the country and all around Michigan. We have Legal Services of South Central Michigan, which services Jackson and Lansing area, Legal Aid of Western Michigan, which services Kalamazoo area, Lakeshore Legal Aid, and other entities around the state. We serve individuals who are low income. They have an income within 125% usually of the federal poverty level, but we do have programs that extend that eligibility up to 200% of the federal poverty level. We help seniors. We don't have an income limit for our seniors, so anybody who is 60 or over can get help. And we assist veterans. Next slide, please. All right. And so the areas that we cover are civil legal litigation. These are not criminal offenses. We're limited in the scope of the cases we can take. We have to make up, because we get the federal funding, we have to make sure that everybody is a United States citizen. We're not allowed to do, take a side politically on things. We're not allowed to do any lobbying. We're not allowed to assist with any cases involving abortion. And so that's a very significant one. But we do help with a lot of these issues that people face that really impact their day-to-day lives. And, we help people with bankruptcy, consumer credit issues. We help people who are dealing with domestic violence issues. We help them get restraining orders. We help with family law, custody issues. We really run the gamut of everything you can think of that you might need a lawyer for, and then some. We help with special education, getting people accessibility in schools, anything having to do with discrimination. We see people a lot of the time on some of their worst days. They're facing those great big life events, such as divorce, housing insecurity, loss of ability to provide the basics in their lives, going through domestic disputes. And they often feel at a loss because the police and courts can't help them, or they don't have the ability to understand and navigate the system. So we help them, and sometimes it's just as simple as listening. And if we can go to the next slide, please. I talk about listening with an active ear for their service needs, and sort of assessing which resources in the community that might be able to provide help where we might not actually be able to, as far as being attorneys, do anything for them, but we can certainly connect them with resources within the communities. And we work with various community partners. I listed out a few of them that people on the call might be familiar with, like Involved Dad, MAID Institute, Mothers of Joy University, MiCHWA, Flint Recast, and the Crim Foundation. So we often, if we've got a child support issue with a dad that's, you know, trying to get involved in his child's life, we might have a go between our attorneys and the people over at Involved Dad to get them into a program that, you know, will help them navigate that child support issue and avoid, you know, penalties and potential jail time for not paying their child support. Of course, we want to get them up to date on everything, but we want to make sure that they're not only just, you know, working to pay the child support, but they're also being involved in their children's lives. And you know, this ultimately rolls over into, you know, betterment for the community, right? So we also engage in a lot of community education. We do outreach programs. I myself have done quite a few classroom visits and presentations to educate the community about childhood trauma and ACEs education. We have a monthly legal lounge where we pick a topic and we invite panelists to come and talk about that topic. And that's broadcast right on our Facebook page. So, you know, we invite everybody within the community to come take a look at that. We have Ask the Lawyer events. We just recently had one over at the Flint Farmers Market for estate planning, wills and trusts. We help with criminal expungement. That is the only criminal area that we do help with. And, you know, we help people get prior convictions taken off of their records, and that actually helps people who are facing housing insecurity sometimes, or elderly people who maybe aren't able to get into nursing homes because of prior convictions they have on their records. You know, that might be from 30 years ago and there's nothing since then, but whatever it is on their record is preventing them from being able to secure housing. We also do a landlord-tenant clinic every week where we assist people with landlord-tenant disputes, everything from eviction to repairs, knowing their rights. And we have an annual fair housing conference, and we also have a fair housing center where we train individuals to be testers, fair housing testers that go out into the community and you know, they try to buy a house or they try to see a house or an apartment, and they record their findings. And if there's any sort of discrimination, racial or sexual discrimination, disability discrimination, anything like that, we're able to take some action to fix that issue for them or help fix that issue. Next slide, please. All right, so I wanted to give just a few examples of legal cases that sort of fall under the legal wellness and community wellness arena. And so the first example, we had a client who had lived, you know, it was a recent divorce. She had lived in her home, raised her children in her home for over 20 years. And for whatever reason, was going through foreclosure. And so the home went to a foreclosure sale, and someone purchased that home at auction for, I believe it was $500. And when someone is going through a foreclosure, even after the foreclosure sale, once that sale happens, they still have a legal right to remain in the house, and they have what's called a redemption period. And that period is either 6 months or 12 months, depending on how long they've been there. This woman, her redemption period was 12 months. But the day after the foreclosure sale, the person who, you know, bought the title to the home for $500 at the sale, went to the home and, you know, illegally locked the owner out the owner who was living there, illegally locked her out, put padlocks on the doors, set their stuff out to the road, things of that nature. So she came to us in a panic, and we were actually able, because this was an illegal lockout, and it was during her right of redemption period, we were able to actually work with her ex-husband to get her the money to redeem the title, which means that she paid $500 to the person who bought the title. And that was her right of redemption. She was able to redeem the property, and now she had it, free and clear for that $500. So not only did we prevent her from being illegally evicted, we were able to settle the foreclosure issue in a way that saved her a bunch of money over the next period of the mortgage. Another example, this is an issue that I assisted with. I help with public benefits such as food stamps and Medicare, Medicaid, cash assistance. And we had a young mother who came in, and she had gone through a period of time where she was not doing very well mentally. She was, these are her words, she was out partying, she was doing a lot of drinking and drugs, blacking out, engaging in risky behaviors, sexual activity with multiple partners, and she ended up becoming pregnant. And as soon as she found out she was pregnant, of course this was during COVID, so at first we thought she, had COVID, but she ended up realizing that she was pregnant, and she immediately, stopped doing the drinking, drugs, and started getting her life back together. And during that course of time, she applied for some benefits for herself and her child. And although the child was granted benefits, she was ineligible. She was found ineligible because the child support office was requiring her to give them a name, to name the father. But she legitimately did not know and had no recollection of who the father was. She did her best to comply with their request, but there was nothing she could do, unless they wanted her to just, name a random person. There was nothing that she could do about it. And this went before a judge at DHHS. And even though DHHS was even advising the judge on the client's behalf, that it was an impossibility. There was nothing that she could do. The judge upheld this policy that didn't make any sense. So we were able to go in on the client's behalf, and we eventually got them to we had to take it to the next level, to the federal court, where the attorney general, was able to step in and say, okay, we're not going to pursue this. This judge is wrong, and actually re-educated the judge about the proper application of the policy. So this mother was able to provide for her child. And the last example that I have for you is support for transgender rights. This is something we were assisting people who are experiencing gender transition and having mental health issues due to their inability to have their legal name reflect their true identity. We were able, and now the law has changed a little bit, so it's a little bit easier, but we were able to actually go in and assist individuals with getting their names legally changed on their documentation, so that they're able to legally, their paperwork matches their identity. So that provided some positive outcomes. And now the next slide, please. And that's really the gist of everything I wanted to talk about. I put my contact information there. So if you have any questions, does anybody have any questions about any of this?
There's a question in the chat that says, can your services help with emancipation?
We can help with emancipation, yes.
And maybe I guess I would say if someone wants to access your services, would they just send an email your way?
They could send an email my way. Down in the corner of the PowerPoint, there's a number there. It's 1-800-322-4512. That's our intake line. And so in most cases, everybody's going to be routed through that line and then directed to the service area that will help them.
Okay. Bobby, I want to say thank you because this is such an amazing service that you're providing for the community, both from the standpoint of just services that people can be made aware of, but also from the education standpoint. I really appreciated the when you were talking about sort of offering opportunities. You've led classes on ACEs, etc. I think this is just a really helpful resource for the community. And I see your Flint office is listed there. Where are you located?
We are located right downtown on Saginaw Street. We're in between Cafe Rima and Hoffman's Deli.
Shout out to both of those places, big favorites of mine. So thank you so much for sharing your expertise and the resources that you've shared with the community. Do you have any last comments?
No, I know we're running out of time here, so I'll just say Happy Mother's Day.
Thank you. All right. I have one last super important speaker who's going to talk a little with us about a really sort of great initiative. It's called Speak for Yourself. Speak for Yourself Flint. I see we have Sharia Ayers, who's the director of this initiative, and she's going to talk to us a little bit about it.
Okay. Good afternoon, everyone. So I do have a quick little slide as well. Oh, okay. Yep, that's fine. Okay. So really quickly, let me put it on the present mode. Right. So again, my name is Sharia Ayers. I am the Director of Events and Membership for Black Leaders Detroit. And first off, I just want to say go green because I am also an MSU alum.
Go white.
Okay, so and two, I just also want to say to some of the panelists, it really warms my heart because I got my degree from MSU in counseling psychology. So just to hear that so many medical professionals are really taking into consideration the mental aspect of health and how that manifests physically, it really warms my heart. And it lets me know that our work is not in vain. And lastly, I don't know if my mom joined or not because she's not heavy, but shout out to all the mothers. It's not an easy job at all. So all the moms, including mine, especially because she has influenced everything that I do. My dad had a strong influence too, but you know, gotta big ups to my girl. So anywho, all right. So Black Leaders Detroit, we have our annual Ride for Equity. This is our third year doing it. And just to give you guys a little background, so the Ride for Equity is a charity bike ride from Detroit to Mackinac. We do this the week before the Mackinac Policy Conference to increase the awareness for the need for equitable funding practices for Black entrepreneurs. So in 4 of the cities that we'll be riding through, because this is, again, a 377-mile bike ride, in 4 of the cities, we will be hosting community conversations called Speak for Yourself. And so this year we will be in Flint. So with that, these are just a few of the flyers that we have circulating. So if you have seen any of them, I would implore you to definitely check us out or sign up because it is also, May is also National Bike Month, which I just learned. So again, we are riding for equity and riding our bikes. But the kickoff date is May 21st, and that is also the date that we will be hosting the Speak for Yourself in Flint. So we'll be riding from Detroit to Flint, 67 miles on the first day to host the Speak for Yourself. The College of Human Medicine via Michigan State is one of our sponsoring partners. And I am excited to go to Flint and have these conversations, because the thing is, what we realize, like, the conversations are just a start. And that's why we do this before the policy conference, because we have the pivotal conversations with community members, and then we can go up there and talk to the people who actually have some more of the initiatives and or lack of better words, influence to make these changes. So that's the whole purpose. So again, I would implore all of you all to come out and support the Speak for Yourself in Flint. It will be held at the Flint Journal. It's open to anyone in the community. However, just for numbers as well as data purposes, we are asking people to register, because again, if this goes well, we will definitely do this again next year. So these are some of our sponsors for the Ride for Equity. And again, I just put this up here just so you all would know, like, people support this cause and what we're doing. And when it's all said and done, health will stay together. So we definitely need to make sure that we are practicing equity across the board.
Thank you so much.
Yes, thank you. So that's it.
Super appreciate you being here. Thank you so much. Super important information. Absolutely get out, ride your bike, attend this event if you can. Hi, Mom. Love you with all of my heart. And CAU units for community health workers. We'll see you again next week. Happy Mother's Day.